Oh, so this is a basic facial video, a how-to, and before we even start our basic facial, we're going to discuss what you do pre-client arrival. So you have to prepare your room, and what that means is that you're going to disinfect your workstation, bed, and equipment before anything. And you're going to use a disinfectant wipe. You're going to follow manufacturer's instructions. Then you're going to check your equipment to make sure that all devices are in safe working order and plugged into a working receptacle. Where you're going to gather clean supplies that you're going to need for the facial service, and they'll be stored in a clean closed container. You turn on the hot caddy and stock with at least 3 clean wet towels. More may be needed depending on the service and the client's needs. You're going to fill clean steamer glass with distilled water, and you're going to preheat that steamer. You're going to dispense products needed for the service according to skin type and client's needs as follows. So you will prepare disposable portion cup or tray for each product with a portion of the product by opening the top of the container and assuring that the tip of the nozzle does not come into contact with the disposable portion cup or tray. Or you can remove the product with a disinfected or clean single-use spatula like this, and then close the lid to the product and set the portion, cup, and tray on to the tray. You're going to prepare your facial bed by using 1 fitted sheet and 1 flat sheet and 3 towels. You'll place a clean laundered sheets down on the disinfected bed. You're going to place a towel horizontally at the top of the bed, head of the bed. You'll lay a hairnet and a headband on top of the first towel, and then along with a roll towel to support the head and neck of the client. You'll save that 3rd towel to lay across the client's décolleté, and then your client will actually arrive at that point. And I'm just going to show you my setup real quickly before we get the client ready. So you can see I have a tray here right by the bed, and I've got my 4x4s, water, disposable gloves, toner, rounds, gauze, all my little bowls with my product in them. I've got my disposable single uses. I've got my fan brush that I will use later on, my implement. I have wooden ended Q-tips for extraction. So I've got water here in a bowl. Everything, my astringent, everything is here to perform the service next to the client. So let's talk about what happens when the client arrives. And when I meet and greet the client, I already have washed my hands, but I'm going to be doing that again in just a minute before I start the actual facial. So when we meet the client, she's not laying down. We're going to welcome her in, and we're going to take her to the work area so that we can have a consultation and assessment. So we determine the client's preferences, we assess the client's needs, and we assess the client's skin by performing a visual skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, an infection or infestation like lice to prevent from safely performing the service. We're going to assess the client's consultation form for any medications and products that they might have used within the last 72 hours, and we're going to consult on any known allergies. We will consult with the client on any facial surgeries within the last 3 months and if the client's under a physician's care. We'll assess if the client is prone to cold sores or fever blisters. We will assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, or hydroquinone, etc. Always encouraging SPF. We will assess facial injections within the last 3 weeks, Botox or hyaluronic fillers. If none of those contraindicators have happened or are in place, then we can proceed with the service. And for my client, she's good to go. So we're going to go ahead and get started on getting her ready. Remember, my hands are clean, but we're going to wash them again before the facial. So I've given her some privacy so that she can put her drape on. And then I've helped her into the bed, the facial bed, and then I'm tucking her in. It's already made with the sheets. Then I've got my towel horizontal, and then I've got my roll towel here that I'm going to put under the neck for comfort. And then I'm gonna apply a headband to keep her hair back. I know if you've seen in these videos, the headbands don't always stay on that well, but we certainly do start with them because she's kind of slippery. She doesn't have any hair, where people are not like that. They actually have hair, and we want to keep that out of their face. And then we've got our third towel that I'm going to drape over her décolleté. And she is comfortable, so now I am going to wash my hands. So I'm going to turn on the water, and I'm going to wet my hands, and I would get a coin size amount of liquid hand soap, and I would rub my palms together all the way down to the wrist. To do that, I would wash the back of my hands all the way down to the wrist. I would wash between all of my fingers, and then of course fingers and thumb. Wash the back of my fingers. Fingertips and nails would be washed individually here. Thumbs. Super important that we wash 20 to 30 seconds, and then we're going to do a really excellent job of thoroughly rinsing our hands off. Once they have had that proper rinse, we find disposable paper towel. We grab that, we turn the faucet off with the hand of the disposable paper towel, and then we dry our hands completely. Throw away the paper towels, and then you finish with hand sanitizer, doing all the same things. And then now you are ready to start your facial. Let me just straighten that out if I can. The basic facial. So what we want to do is remove her makeup to start. So I'm going to get that going. And we need to do our first cleanse. So we're going to some cleanser. need to remove her cleanser. Okay, so we've removed the cleanser from the first cleanse, and now we need to analyze her skin with a magnifying lamp or a Woods lamp, which I don't have either. We're gonna pretend. So first thing that I need to do is protect her eyes. So we're gonna cover those eyes up, and then we're gonna bring over a magnifying lamp, and we're gonna turn it on. And then this part is where we do take a good minute, and we really want to focus on looking for several different things that, maybe some things that you've discussed that she has specific concerns with, but then this is where your job is to come in and to see what it's like. So we're looking for things like flakiness, freckling, abrasions, fine lines, hyperpigmentation, anything, excess sebum, anything that we, congestion, that we want to talk to her about, not only because it helps us perform this service better, but also because it's going to help us with potentially products that she could be getting to take home to help with. So every time she comes for service, it's better, or it helps better, helps her maintain better, but also it helps come up with a plan for other services or things that she might need to do in the salon that would be a huge benefit to her skin as well. So taking a minute here to really look under that lamp in the magnifying and really getting in there and seeing what you see. And this particular client has really good skin, but she is extremely dry. So there's a lot of fine lines, flaky, dehydrated, so a lot of buildup there, dryness that we just need to get off. And so that's what we're really going to be focusing on today with her basic facial. And then I can recommend and suggest treatments for next time, and then some home care, follow-up, etc. So I'm going to turn the light off and move it away, and then we can take off the cotton pads, and then we need to proceed with cleanse 2 and cleanse 3. So let's go right into cleanse 2. So that's great. Now we need to remove Cleanse 2. And then we need to proceed to Cleanse 3. Final cleanse. So she should be really clean by now. So we've got to remove the cleanser. Final cleanse, so we got to get it all off. And if I had a hot cabbie, I would be using a ton of towels versus these 4x4s and gauze squares, but I don't. Because who wouldn't love a nice warm towel to clean everything off every time? A new fresh one. Amazing, of course. Perfect. little bit of water on the ear there. Sure, that didn't feel very good. Okay, so she is cleansed, and following the third cleanse, we're going to tone. So that's what our next step is going to be. You could gently mist over the face, but I'm actually going to use the squares with, I'm going to spray my squares. That way there's never a startle when I come in. I'm going to tone the face and the neck, following the cleanse. Okay, so we've cleansed and we've toned. And the next step is exfoliation. So we are going to get some exfoliant. And depending on the type of exfoliant that you apply, you're going to follow obviously manufacturer's directions on everything and recommendations, but we are going to take a minute or two to massage in the exfoliant. Of course, we would know exactly what to do based on what we've chosen, etc. So once you finish your 1 to 2 minute massage, you will go to the next step of exfoliation, which will also be a pretend for me in here because I don't have what they want us to have, which is the facial steamer. So we're going to pretend that we have a facial steamer, and this is the point that you would go get the facial steamer, and you would bring it over to your bed, bring near the facial bed, and you're going to turn it on. But you're going to make sure that the steamer is facing away from the client as the water heats up and emits out an even flow of mist. Once the steamer is emitting a mist, position the steamer 16 inches over the client's face and aim at the client's chin for even distribution on the face, allowing the unit to function for 3 to 5 minutes. So you're going to find your unit. It's over here. You've turned it on. It's facing away from your client. It's emitting that steam, that mist. You're going to turn it towards the client and you're going to turn it towards the chin, 16 inches away, so that it can evenly come up and over the face. And then you would leave it for 3 to 5 minutes. Once it's done its course, the 3 to 5 minutes that you're leaving it on, you will remove the steamer from the client's face, return it to its previous location for disinfectant. You're going to turn it off. So obviously we don't have a steamer and we're pretending, so we've done that. We've steamed and then we put it to its previous location for disinfectant. Now it's time to remove the the exfoliation. And I'm going to use a hot towel from the cabbie for practice, but I don't really have a cabbie. So here's my hot towel, and of course I'm going to shake it out because, oof, it's hot. And I'll check it on my insides of my wrists. I'm also going to check it on her collarbone once it feels good to me. And she says it feels good to her. So now I can take the towel and apply it to my client. And so I'm going to simply lay it on the face, and I'm going to leave her nose out. Everything else gets covered up. And she gets to feel that nice steamy. And I personally prefer, it's not about me, but I personally, having a facial, prefer the nice hot towels to cold water or cotton. So obviously I would recommend that. I'm just removing the exfoliant. Once your exfoliant has been removed, it's time to do the extractions. And if you do not already have on a pair of gloves, this is the time that you would put on a pair of disposable gloves. You'll throw them away after you put them on and use them. And you can do the extraction a couple ways. You can use cotton rounds that have been soaked in astringent with your fingers, finger method, or you can use wooden Q-tips, wooden stick Q-tips, which is what I'm gonna do, soaked in astringent. So they're these. And what you have to know is that you can use this for one extraction, and then you have to throw it out and get two more, throw it out, get two more. As you work along, where your cotton rounds with your fingers, you can soak them in astringent and work around the round. You don't have to throw it away until you're done. So I am going to soak mine in astringent, and then I'm going to get started with her extractions. Which she does not have a lot. Her issue's more really dry skin. Throw it away. Picking up two more, soaking them in astringent. Throwing it away, getting two more, soaking them in astringent. one more. Last one. And throwing them away. At this point, you remove and toss your disposable gloves. And you will tone. So you follow your extractions with toner. So I'm going to spray my toner on. And good news is, after extractions and that discomfort, she gets to move forward to massage. So we have extracted, we've used toner, and now we're going to go into the massage portion of the facial. And make sure when you go into your massage portion that you get enough product, whether it's oil or lotion, just so you don't have to go back and try to get more. It's distracting. So want to make sure you start out with the right amount and spread it out really good before you start, so you've got it evenly distributed throughout the face, neck, and décolleté, and you'll be able to start your massage. massage is over and we've got to remove the massage product. Skin looks amazing, and we're going to do the next step. So after massage is mask. So we are going to apply a facial mask. Applying it very carefully, avoiding the mouth, the nose, and the eyes. Now with masking, obviously depending on the mask that you choose, you obviously follow the manufacturer's directions, but with your mask you usually allow, depending on what it says, to sit on for 5 to 10 minutes. So obviously we are not going to have the mask sit on for 5 to 10 minutes for the sake of the video. So what we're going to do is actually remove the mask, but keeping in mind that this part of the facial, it would actually stay on for quite a few minutes. So we're going to take that off now. So the mask has been removed, so we're going to tone. And her skin just looks amazing. She's just going to be so pleased and so happy with her results. And to complete her facial, we're going to finish up with some skincare. So we are going to apply a tiny bit of eye cream to the ring finger, both ring fingers, and we're going to lightly tap it on to the brow bone and the zygomatic arch. So you just want to use little tapping movements, and you don't need much. And we are going to put on a hydrating, very hydrating moisturizer because we know how dry she is, with SPF. It's not nighttime yet, sun is not down yet, so we are going to make sure that we apply our moisturizer with SPF, and everywhere that she potentially could get some sun exposure. And blend it in really nicely. So I'm going to say décolleté, the neck for sure, face. If she's going to wear her hair back maybe when she leaves, her ears. And I would also, if an option, maybe apply a little lip balm, a little hydrating lip balm to finish as well, because who doesn't want that? So everything is hydrated, lip, face, neck, décolleté, glowing and gorgeous. Blend it in. And that would complete her facial service, which I would give her a little privacy at this point then to get dressed or come out of the cape, and then meet with her to check her out and then discuss her maintenance of an aftercare of the facial, recommend products, etc., get her out of here and gone, and then I have to go back and clean and disinfect my work area. So I would identify a proper cleaning agent and read the manufacturer's directions, following those manufacturer's directions for mixing and usage. I would wipe down my workstation and area with cleaning solution to remove debris. I would identify, before I do any of that, I have to discard any single-use item that I might have not used that needs to be thrown away. And then my implements would go in a closed container labeled to be disinfected. And then the sheets, the cape that she took off, the towel, all the towels, etc. They go in a closed container until they're laundered. Then we start the work area disinfection. So that's where we would identify proper cleaning agent, read manufacturer's directions, follow manufacturer's directions for mixing and usage, wipe workstation area with cleaning solution to remove debris. Identify disinfectant that is bactericidal, virucidal, and fungicidal, as well as EPA approved for use in salon setting. Follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. Then we would disinfect electrical equipment and store it in a clean area separate from other implements. And because we used that kind of disinfectant, we would have had gloves on. So we need to throw away those gloves, and it's time to finish out by washing our hands. So we turn on the water, we wet our hands, we get a coin size amount of liquid hand soap, rub your hands together down to the wrist, the palms, both palms, and then the back of the hands we wash as well down to the wrist. Between the fingers and then between the thumb and the fingers, backs of the fingers, fingertips and nails, the whole finger, we're interlacing and interlocking like this under the water, and then wrist to finish out. And we rinse everything thoroughly, or at least 20 to 30 seconds doing all this movement, minimum of that. And then we rinse it perfectly. We grab disposable paper towel, and we use that hand with the paper towel to turn off the sink. Dry your hands completely, and then toss the paper towels. And then to finish the hand wash, of course, we grab sanitizer and do all the same things that we just did previously for this finish. And that concludes the basic facial video. You can be prepared at that point for your next service.